Happy Friday, everybody. Welcome to my outside edition of today's Friday Facebook Live. I'm still in the 12 o'clock hour, so we're close. Hey, this is summer. I know for those of you with kids, once August 1st hits, it's a challenge, and we're all trying to get last minute things accomplished before back to school. And here personally, we have 2 kids that'll be leaving for college in the next week to week and a half, so the days are filling up fast. If you hop on today, please say hi if you're joining me live. If you catch this on a replay, just comment replay below so we know who's watching. I have a few things to talk about today. The first thing I want to review just in person, in video, is the brand new referral program that we're rolling out as of effective yesterday. Some of the first patients got their certificates or their coupons this week. So as a small business, word of mouth referrals, you guys really are our biggest referral source, and we're so grateful. I know with the setup that we have here, with the out-of-network experience that we've created, we know that it's a leap of faith, and we value people placing their trust in the investment that they're making in their plan of care. And those of you that have experienced the results firsthand, you really are the ones that can share that message better than Raven and I or Jenna speaking. So we wanted to thank you for that. Jenna created little coupon cards, and they're available to be picked up at the office. We're giving each patient 5 of them. Don't worry if you don't have them. You can get started with the referrals without the coupons, because there are several of you who have referred multiple patients here this year, and we're counting those patients for you. So this is something that we plan on carrying forward, that will start over each calendar year. So for those of you here that have referred some patients to us this year, we have marked those down. Like the graphic that I shared this morning displays or explains, the person that you refer will receive a value of $94 off of their first session. That's half off. So they are receiving a thank you for taking a leap of faith and trusting us with getting started with their plan of care. If that person then becomes a patient and comes back for additional sessions, then you as the referrer will receive a monetary credit, and I think it's $25. What we're going to do is you can use that $25 credit. It can be applied to your account to be used towards your own sessions. It can be used off of products, supplements, any merchandise that we might have. There is some swag in the office now, so you could use it to go towards that, or it can go towards your next session. So it's a credit off of services or products, and you have 5 opportunities to share that. So for each person that you refer, each person gets half off of their first session. If and when they become a patient, then you receive the credit. So if you do that 5 times, then you have the opportunity to receive $100 off of your next session. So just a little way to say thank you for those of you that are already out there sharing and referring our practice. And so that is in effect now, and we plan to, if it goes well, continue to keep it carrying forward. So talk to Jenna about your certificates the next time you're in the office. For today's topic, we're going to talk about acute low back pain and what should you do when that happens. A couple of weekends ago, on a Saturday morning, I received a phone call that somebody in my extended family was in terrific back pain, and that's scary. He couldn't move. He couldn't move in bed. He was having tremendous difficulty getting out of bed, even walking to the bathroom, and they wanted to take him to the emergency room. I don't know if that's happened to you or anybody in your family. It definitely has happened in our family, and I thought it's a good talking point for what can you do and what should you do, and hey, when do you need to go to the ER? And what I will tell you is, for this person, with my help, we were able to avoid going to the emergency room. Since it is our goal to be the people that you think about when this stuff happens, we're going to start creating some content that'll help you when something like this should happen. So, acute low back pain, that throwing your back out situation, where whether you did something like bent over and picked up a piece of furniture and felt a pop, or you just got out of bed in the morning and as the day went on you increasingly started to experience this acute pain, just means new and fresh, and sometimes it can come out of nowhere, and sometimes there's a reason for it. Sometimes it starts off kind of mild. Oftentimes, low back pain starts off with some warning sign. You might have a few days or so where you're like, something is not quite right. And then maybe you wake up, or as that day goes on, it gets increasingly bad and you don't know what to do. So if and when acute back pain strikes, first of all, you're always welcome to send us a message. Raven or myself are always available. That's part of the perk of this practice, is that our phone number to the office is text capable. I see the text messages that come across. Even on the weekends, you can always reach out to us. We are always available for help. One of the very first things, now I'm going to preface this by saying it's difficult to give generalized advice in a situation like this. So what I'm speaking about in particular is central, so right in the middle of your low back, down by your belt line, or this pain across both sides of the low back. It might go into the butt, the glutes. This is the pain that I'm talking about. If you have pain that is radiating down one leg, if you look at yourself in the mirror and you literally look like you're crooked, then what I'm going to tell you is not going to help, and you're going to need to probably come in for a session. But if you cannot straighten up, if it hurts to bend over, if you're having difficulty moving and it's back pain in the center and on both sides of on both sides, or one side, could be one side, then this is what I'm going to suggest you do. And it obviously comes with a disclaimer of this does not replace a physical therapy evaluation. It is something for you to try and see if you can minimize your pain and get you comfortable until, if you need to come in and be seen by Raven or I, or a physical therapist. So if that back pain is striking, one of the first things that I would encourage you to do is to just lay down flat on your stomach. Just get down on a firm surface. It can be the floor if you can get down there. It could be a hard mattress, but just get yourself on your stomach. What you're looking for is a position in which you can rest with the symptoms as quiet as possible. Now, for some people, this family member of mine was one of them, they were having a hard time even standing up straight. And if that is the case, when you're standing, you're a little bit bent over, you're going to have a hard time even just laying flat on your belly. So the recommendation then would be, if laying down on your stomach is too much pressure or increases the pain that's in your back, then you can try putting 1 or 2 pillows right underneath your hips, right underneath your hips, and then lay over the pillows. And that's going to give you a little bit of a accommodation, we say. It's going to take up some of the slack for you. And that's where you would start, and you would stay there for 20 or 30 minutes if you need to. And ultimately what should happen, if that's the case, is that in time, you might even just kind of get a little itchy, like it's time to move. Then a family member could take one of the pillows away. You may find, if you start on a couple pillows, that given 20 or 30 minutes, you can actually get yourself all the way flat. If you find that on your stomach, with or without a pillow, is too uncomfortable, then another position that is often helpful we call hook lying. And what that means is you're laying on your back and your knees are bent and you put a couple pillows under your knees. Some people will actually like lay on the floor and put their legs up on the couch. That's a common position people will tell me that they've gotten in if they're in some back pain. But even flat on the bed or the floor with a couple pillows under your knees, that can be a comfortable position for you to be in. The things that you're going to want to do and not do, and what to watch for. So when back pain strikes, the things that you need to use caution with are bending, lifting, and twisting. So you're going to want to keep your back, your spine pretty straight. So you're going to want to move your knees and your nose in the same direction. You're not going to want to do a lot of this twisting motion. You're going to want to keep everything moving together, like rolling like a log in bed. You're going to want to keep moving as much as possible. Movement is medicine. You guys have heard me say that. So you may have to modify your work or your exercise routine for the time that this pain is the most sharp, but you should try to keep yourself moving in short periods as much as the pain will allow. And limiting sitting is also probably something that is going to be helpful. So you should either be standing, walking slightly, or laying in one of those positions of comfort. Sitting can be compressive to the spine, and so if you sit, you're going to want to sit in a firm straight back chair. You're going to want to place a pillow behind your low back so that you're nice and supported and that you don't fall into that rounded posture position, and just limit that sitting as much as you can, and your body will tell you when it's time to move. So some of the things that will also be helpful, or I've found helpful, is to use ice to the area. So an ice pack. When pain is new, my recommendation generally is ice. Heat may come in later, but for the first 24, 48 hours or so, a ice pack to the back can be helpful. Anti-inflammatory medications can also be helpful. Some people need to alternate anti-inflammatory with like a acetaminophen or a Tylenol. So when I say an anti-inflammatory, that means a non-steroidal anti-inflammatory. What that means is Motrin, ibuprofen, Aleve, and Advil. All of those are the same category of a non-steroidal anti-inflammatory. And so you can alternate one of those medications for inflammation with a Tylenol if necessary for pain. The Tylenol is not going to help the inflammation, but it might help with some of the pain. And the anti-inflammatories are going to literally help with some of the inflammation. So that can be helpful. So assume a lying posture, prone if you can. Short periods of standing and walking and limited sitting. Ice, anti-inflammatories, Tylenol if need be. That'll help get you through an acute episode. Limit your bending, lifting, and twisting. So how do you know when it is an emergency? Because back pain can be intense and it can be scary. And had this family member not had my connection, he would have gone to the emergency room. So what would have happened had he gone to the emergency room is they would have seen someone in acute pain. They might have taken an x-ray. That would have shown nothing. He would have waited for hours in very much pain in the emergency room. And they likely would have called it a muscle strain. Not the most accurate diagnosis professionally. And they might have given him some medication, like pain medication. Maybe. They don't always do that anymore. Sometimes they give you some muscle relaxers, something or a shot in the butt to sort of help with the pain. But they're going to recommend that you see your primary care doctor. Again, hopefully the recommendation, I believe it should be to your physical therapist. But about the only thing that you'll get is maybe a little bit of medication that may or may not help you with your pain. And you're going to have spent a lot of painful time and money going to the ER to not quite understand what the cause of your problem is. So my preference is do what we said first and then give us a call. If it's the weekend, you give us a call and we'll help you get through the situation. When is it time to go to the emergency room for acute back pain? I'm going to give you, there's a couple of, we call these red flags. And if we hear them or see them, then this is when we know it's time to send somebody to the emergency room. If you have progressive weakness in the legs, that's an indication, meaning you're not able to stand up, you can't hold yourself up, and you notice that it's getting worse. So progressive weakness, particularly in the legs, and we're talking about low back pain. If you cannot feel your bowel and bladder function, which includes that area. So loss of sensation in, we call that your area, your perineal area. If you cannot feel that you have to void either urine or stool, so if you're having an accident or accidents in either of those categories because you cannot feel sensation down there, then you have a situation that is literally an emergency. You have compression of the nerves from the sacrum that go to that peri area, and that is a surgical situation. Those are the biggest reasons why someone should seek emergency situation, because it's surgical for low back pain. Most of the time, we're able to avoid that, and most of the time getting into doing the conservative things that we talked about and then getting in to see myself or Raven can save you valuable time and money and get you moving, and our assessment will accurately help diagnose the movement and the direction that you need to fix your problem. One of the things that we'll do if we see you and we think we need a little bit of help, then we will often make a referral to a primary care doctor, because there are a few things that can be helpful. One of which is a muscle relaxer, and the other one is a steroid dose pack. Those two things, when given by a primary care doctor, can actually help us shrink the inflammation and the process that's going on there mechanically in your back and help the therapy be more effective. So that was a lot of information. I hope that it made sense. If you need clarification, please ask. I'm happy to answer comments below. I think that's Sandy that's on here. Hi, Sandy. So let me know if this makes sense. Of course, if something should ever happen to you or your family, please reach out to us as soon as possible so that we can help you through the situation. Literally, that acute back pain is the perfect example of what I mean when I say we should be the go-to person to help you. So that particular family member of mine had a few rough days. We avoided going to the emergency room. I did a home visit because I know him, and he had one visit in the physical therapy office. So for the cost of one physical therapy session, I got him on his way, and he avoided the emergency room and the expenses and the frustration and the pain that he would have endured going that weekend. I hope that you think that that's a valuable thing. So all right, you guys have a fabulous weekend. Let me know if anybody has questions. Thank you ahead of time for continuing to share Fit for Life with your friends and family. We're looking forward to meeting some new friends of yours, and for thanking you for sharing us with those who need us. Have a great weekend, and I'll talk to you guys next week.